Good morning, everyone. My name is Randy Evans, and I serve as the Public Health Director for Pueblo County. Today, we're here to share information about Colorado's first known measles case this year. On March 31st, 2025, a positive measles case was reported from a commercial laboratory for a resident in Pueblo County. Subsequent investigation by our team found that this person was an unvaccinated adult with recent travel to Mexico, where there is an ongoing outbreak of cases. The person returned to Pueblo and to work and later presented to the local urgent care on March 22nd with measles symptoms. Public health became aware of this case when the lab reported the result on March 31st. Our department is working very closely with the Colorado Department of Public Health and Environment. The Pueblo Department of Public Health and Environment is taking the lead on case investigation and contact tracing. We've also been working with child care providers, local healthcare providers, and others to assure that they are aware. The Colorado Department of Public Health and Environment is providing additional immunizations and treatment support for PDPHE, as well as helping us to reach out to our local healthcare providers and other agencies. At this time, I'd like to introduce Dr. Rachel Herlihy, who will give you some more information about measles.
Good morning, everyone. Thank you for being here. I'd like to share just a little bit of information about some of the key features of measles infections, particularly talk about some of the clinical features, signs and symptoms for folks to watch out for, and then also talk a little bit about why measles is such a challenge for public health to manage. First, I want to talk about how highly transmissible measles is. In fact, measles is actually the most transmissible infectious disease that we know of. It's much more infectious than other infectious diseases that we see more commonly and have come to know over the last couple of years. So much more infectious than COVID-19, much more infectious than influenza. In fact, it is so infectious that if there are 10 non-immune people that are exposed to measles, 9 of them will go on to develop infection. Measles is also not just a rash illness. Measles is actually a severe infection. And if you look at national data from this year and the last couple of years, when we look at severity rates associated with measles, we see typically a 20 to 40% hospitalization rate associated with the infection. So those are pretty high hospitalization rates and really indicate the severity of this infection, particularly in our most vulnerable population, which is going to be our youngest children and infants that are too young to be vaccinated. Some of the complications that we see in measles include things like hearing loss, pneumonia, encephalitis, which is a type of brain inflammation. And tragically, we also know from the outbreaks that are occurring in Texas and New Mexico that cases can be fatal. Both Texas and New Mexico have had deaths this year associated with measles. The good news, of course, is that measles is highly preventable. We have a highly effective vaccine, the MMR vaccine, that with 2 doses is 97% effective at preventing measles infection and provides lifelong protection against the disease. Some of the symptoms to be aware of, if you are concerned that you or members of your family are susceptible to measles and may have been exposed to measles, the type of symptoms that we see with measles start pretty generally with typical viral respiratory illness type symptoms. So we often see cough, runny nose, we see conjunctivitis, which is pink or red eyes, runny eyes, a high fever occurs. And then typically about 3 to 5 days after those symptoms starts, that's really when we see that widely known feature of measles, which is the rash that starts on the face and then descends down the body. And it's important to know that the infectious period, or the time that you can spread measles to other people when you are sick, starts 4 days before that rash develops and lasts to about 4 days after that rash develops. So that means that people may have measles, but may actually think they have something more like a cold or the flu or COVID, and potentially spread that virus to other people before they know they have the illness. And this is part of the reason that it's really important to seek care early, call ahead before seeking care if you are worried that the illness you are experiencing is measles. Also important to know that the time from exposure until the time that someone develops symptoms, which is called the incubation period, is typically going to be about 10 to 12 days when you're talking about that exposure to someone with measles until someone develops those first symptoms. When we talk about the time from exposure to the time someone develops a rash, that's generally right around 2 weeks time, but there really is a range anywhere from about 7 days all the way out to 21 days. And again, that's very different from what we experience with the flu and COVID, where your symptoms start typically just a couple of days after you're exposed to someone. So a very different infectious disease than what we typically see when we think of other common viral respiratory illnesses. And I will hand it to Dr. Kalach. Thank you.
Thank you, Dr. Hurley. I just wanted to say a couple things. First of all, I want to recognize the great response and partnership that CDPHE has with the Pueblo Department of Public Health and Environment. They've been right on this issue, doing contact tracing, investigation, notifying the medical care community, and have just been super partners. So, Randy, I really appreciate working with you. And then I want to just underline something that Dr. Hurley said. Because measles is so infectious, we want to make sure that people get the care they need as early as they can, and we want to make sure that we protect anyone else from being exposed as well. So if you have concerns that you or a family member may have the measles, call ahead before going to your emergency department, your clinic, or your doctor's office, so that your healthcare providers can make preparations to bring you safely into their clinic and not expose other people to this highly infectious illness. That should not stop you in any way from getting the treatment you need, but it does help us protect the health of the rest of your community. So I think at this point, we'd like to go ahead and open it up for questions. Gabby Johnson will try to direct those. Gabby, if you can start taking questions, that would be great.
You bet. For those who want to ask a question, just go to your reactions button. And there should be a raised hand function. Raise your hand and we can call on you. If you can please just ask one question at a time. We've got a lot of folks to get through and want to get you as much information as we can.
So I see John's iPhone with the first hand.
All right, John, you want to go ahead and ask a question?
Then let's move on, if we could, to Meg Wingirter. Sorry, Meg.
Hi, this is Meg from the Denver Post. So for families in Pueblo who have infants, should they consider getting early vaccination, or should they continue to wait until the babies turn 1? Thank you.
Yeah, I can take that question. So typically our recommendation for early vaccination, meaning receiving a dose prior to when the first dose is typically given at 12 months of age. So between 6 and 12 months is for infants that are traveling internationally or to areas with outbreaks. At this point, we have 1 case of measles in Colorado. So we do not have an outbreak of measles in Colorado. That would be considered 3 or more cases. But certainly I think it is important for folks to be talking to their healthcare provider about their concerns and thinking about that option for early vaccination, especially if we were to see more cases occur in the state.
Thank you, Rachel. I see that we have CNN on the line. Would you like to go ahead and ask your question and introduce yourself?
Hello, this is Neha from CNN. I was wondering if the outbreak in Mexico where the person was exposed is the one that's linked to the Texas-New Mexico outbreak, as World Health Organization last week confirmed that there had been some Mexico cases linked to Texas.
This is Dr. Hurley. I can take that question. So we do think that it is highly likely that this case is, as you know, traveled to Mexico and could potentially be linked with outbreaks in other states, as you indicated, the World Health Organization has reported on. We won't know until we can get some definitive information through whole genome sequencing, DNA sequencing, on this particular virus that we have isolated from the Colorado patient. So to know definitively, it will be several more days at least, but we do believe that it certainly is a possibility.
Thank you. And do you know where in Mexico the person had traveled?
Yeah, so to protect this person's privacy and identity, we're not releasing additional details of their travel history.
Thank you.
Thank you, Rachel. Alana, do you want to go? Is it Alana or Elena? I never remember.
Hey, it's Elena with Axios Denver. Thanks for asking. I have a two-part question. So, Health and Human Services Secretary RFK Jr. has touted vitamin A as a measles treatment. So I'm curious if CDPHE has any comment in response to this advice, if it's backing what he's saying. And then the second part of that question, just related to HHS, is whether CDPHE has any concerns about the layoffs that were announced. It looks like there's going to be about 10,000 HHS staff being laid off. And I'm not sure if this, as our first case of measles arises, if there are any concerns connected to that. Thanks.
Rachel, if you take the clinical question, I'll take the second question.
Great. Okay. So unfortunately, really, the primary treatment for measles infections is going to be supportive care. There is a role for vitamin A. There is limited evidence that does support the role of vitamin A treatment, particularly in children, particularly in hospitalized children or children with more severe disease, in improving outcomes from measles infections in those children. But I will say it's really important that vitamin A is given under the supervision of a healthcare provider, because we know that there is significant toxicity that can be associated with vitamin A. It is one of those vitamins that can accumulate and cause toxicity, particularly liver toxicity. And unfortunately, that has occurred recently. There's been reports of cases of that in Texas. So that is absolutely a situation we want to avoid. I think also really important to note that that limited role for vitamin A in treatment is not preventive, right? So vitamin A is not going to be a preventive therapy for measles infection. For that, we really need to rely on vaccination. The MMR vaccine is the really one effective strategy we have. And again, it's highly effective for preventing measles infection.
I just want to underline that no one should be giving vitamin A to another person without the input of a healthcare provider. The evidence, as Dr. Hurley said, is limited, and it's limited to very sick younger children. I think that thinking about doing this on your own or doing that because of kind of popular information is a real risk for individuals getting vitamin A toxicity. Regarding the administration's approach to Health and Human Services, at this point, we have insufficient information to be able to predict whether or not that'll have an impact on Colorado's ability to respond to the current measles case.
Thank you.
Thanks, Dr. Kalanch. James Bartolo, did you have a question?
Yes, I did. My name is James Bartolo with the Pueblo Chieftain. I understand that CDPHE in a March 31st release, they had identified two known exposure locations in Pueblo, those being the Southwest Deli and Cafe on South Pueblo Boulevard, as well as the Southern Colorado Clinic in Pueblo West on South Burlington Drive. I was wondering if there were any other known exposure locations and dates.
At this time, we are continuing to investigate that, but at this time we have no other known exposure locations. The good news is that this individual has not traveled outside of Pueblo. And so we believe it is limited to Pueblo, but we do not have any additional sites at this time.
Thank you.
And Jasmine, I think you're up next.
Hi, Jasmine with CBS Colorado here in Denver. My question, not sure if you answered it, but I just got into Zoom. Does the measles vaccine provide lifelong immunity, or do people need to get revaccinated at some point for those who have already gotten the vaccine?
Yes, so that is the great news about the MMR vaccine for measles prevention, in that it does provide lifelong protection. But I will say that there are certain people who may want to think about getting a dose of the measles vaccine, MMR vaccine right now. So if you are not confident in whether you were vaccinated as a child, that is certainly something to consider. We know that there is a small group of individuals who were vaccinated with an earlier version of the vaccine that is not as effective. So that would have been people who were vaccinated before 1968. Those individuals are recommended to go ahead and receive a dose of the MMR vaccine if they have not. And then there's other people who we want to make sure have had 2 doses of the vaccine, which is what is routinely recommended for children now. But some adults have just received 1 dose. But individuals that might be higher risk, like healthcare workers or people who are traveling internationally or areas with outbreaks, really may want to consider having 2 doses of the vaccine. Again, that's a lot of information. There's information available on our website, on CDC's website, and always great to talk to your healthcare provider about whether you might fall into some of those limited categories.
I would just add that measles is a safe and effective vaccine. If you're concerned, I would contact your healthcare provider and seek vaccination.
All right, and I believe Carly Moore is up next.
Hi there, Carly Moore with KDVR and KWGN in Denver here. I had a similar question to that last one. I just got some information that maybe some people who were born between 63 and 83 may have only received 1 dose. And so you can confirm that for me, but for those people, they could get another dose at any time? Is that a concern? Is that correct information there? Thank you.
Our recommendation for adults is typically that you have at least 1 dose of the vaccine. 1 dose of the vaccine is highly effective. We estimate 93% effectiveness. That goes up to 97% with a second dose of vaccine. But for most people, really that 1 dose is going to be adequate. If you are concerned and you don't know if you have received a measles vaccine, it is certainly okay to go ahead and get another dose. But we aren't recommending that everyone who's had just 1 dose of the vaccine go out and get a second dose at this point. 1 dose of the vaccine offers substantial protection.
Thank you.
Thank you. And John's iPhone, we don't know if that's John Ingold or John Daly. Are you in yet? All right, well, let's move on to Evan. John, if you're there, we'll get to you. Evan, you're up next.
Thank you. Good morning. What do vaccination rates look like right now in the state?
So statewide vaccination rates really vary depending on which group you're looking at. If you're looking at our kindergarten vaccination rates, which is one of the common measures that we use, that rate statewide is about 88%. If you're looking at older children, so children through high school in Colorado, that number goes up to about 94%. What we call the community immunity or herd immunity threshold for measles is about 95%. So statewide, we are falling short of that. So that does mean that Colorado is potentially at risk for outbreaks. But honestly, what is most concerning are pockets of under-vaccination that we know exist across all of the state in certain communities, schools, childcare facilities where vaccination rates might be well below 80%. And in those communities, that's really where the greatest risk for measles outbreaks exists.
Randy, I wonder if you'd like to just talk about Pueblo's rates.
Sure, glad to. Our rates are similar to what Dr. Herlihy mentioned, but for our for 2023-24 data, our kindergarten MMR, so those kids who are just entering kindergarten in the city was about 84%, and in our surrounding counties about 92%. But as we look at those kiddos from kindergarten through 12th grade, our rates are much better at 95, around 95% in both the city and the county. So we are in pretty good shape there. We would like to see our younger children 0 to 5 at a higher rate than where we are.
Thank you, Randy. Real quick, you mentioned those pockets. Do we know where those pockets are?
So one really important source of information that is available on our website is the school and childcare database, where you can search across the state, across counties, for school districts and individual schools or childcare facilities, and look at the vaccination rates in your community in those school and childcare facilities. So certainly encourage all of you in the public to look at those websites and understand what the risk might be in your community.
Great, thank you.
Thanks, Dr. Herlihy. Meg, did you have another question?
Thank you. Do we have any information on how the patient's doing, if he or she needed to be hospitalized or anything? Thank you.
Director Evans, do you want to speak to that?
It's our understanding that the individual is doing well and has basically finished the course of the infection.
Thanks, Director Evans. Brandon Lennon, did you have a question?
Hi, Brandon Lennon from Colorado Collegian TV. I was wondering if there's any information on the amount of people exposed to the individual.
At this point, we're still trying to figure that out. There was for the Southwest Deli, we are looking at a time period between March 17th and March 21st. And for the Southern Colorado Clinic, we're looking at the time period of 3:30 to 6 p.m. on March 22nd. So we know that there are individuals who patronize that business and or who were at the urgent care at that time, and we are currently continuing to try to identify who they are.
Thank you. And John Daly has a question. I think he's having some technical difficulties. His question is, what will the CDPHE state measles campaign look like? Will it include ads, PSAs, vaccine clinics, a dashboard? If you could provide some of those details.
Yes, absolutely. So we have already and are in progress of updating website content to share this information. We're pushing information out to Colorado healthcare providers to make sure healthcare providers across the state are aware. And we also have an active, ongoing Mightier Than Measles campaign that we have rolled out across the state, in addition to some of our immunization reminder recall activities where we are reminding parents of children who are not up to date on the MMR vaccine that now is the time to get your children up to date.
I think this single case at the current time is an excellent bellwether to help parents and remind them about the importance of getting their children vaccinated at this point against measles, but all their childhood vaccines, which are the safest and most effective ways to prevent diseases that can hamper their health, lead to hospitalization or other problems down the line. So I think thinking about checking up on how your children are doing with their vaccinations, contacting your healthcare provider and getting up to date, this is the time to do it. And this is a reminder that this is the best way to prevent these illnesses.
I want to thank everyone for joining us. I know you have some additional questions, reporters out there. Those can be directed to Pueblo, who is leading this investigation. That information, contact information, is in the news release we sent last night. And without further ado, hope the rest of you have an enjoyable afternoon. And thank you very much for joining us today.